Well, monkeypox is top of mind for many health officials today. A rare case confirmed in the U.S. as doctors in Massachusetts are trying to figure out how a man contracted that virus, which is typically found in parts of Africa. Meanwhile, a patient now exhibiting similar symptoms in New York City. And NewsNation's Paul Gerke is there live. So, Paul, health officials believe this is possibly another case of monkeypox.
It is possible. Right now, the New York City Health Department is investigating whether or not it is monkeypox. That patient is being kept in isolation here at Bellevue Hospital behind me. Once those test results come back, the city will send them over to the Centers for Disease Control and Prevention, which will then confirm or deny that case of monkeypox. This virus generally spreads only from rodent to human, but this recent cluster of cases seems like it's spreading from human to human, making us pose the question, do we need to reconsider what we think we know about monkeypox? According to the CDC, monkeypox can spread through respiratory droplets, close contact, and via contaminated surfaces. Much of this new cluster appears to be the result of direct sexual contact between men. Monkeypox typically doesn't spread nearly as easily as a virus like COVID-19 does, making this group of cases unexpected.
It is unusual to see an outbreak of monkeypox.
That's Dr. Anthony Harris, live on Rush Hour last night. We've heard lines like that before, and recently, as agencies change public health guidance early and often during the pandemic, undoubtedly sowing doubt in the minds of many Americans. A January poll from the University of Pennsylvania Annenberg Public Policy Center showed trust in the CDC was slipping at the start of the year, falling from 77 to 72%. The agency has been attacked over shifting vaccination and masking recommendations. An NBC survey found that when it comes to COVID, nearly half of Americans believe their school or employer over the CDC. But when it comes to monkeypox, the science is much more settled. COVID-19 was a brand new virus. Monkeypox has been studied since 1958. There are vaccines used for smallpox and proven 85% effective, as well as antivirals to treat it. Plus, the infection is generally mild.
I would emphasize that historically this has been a very rare disease with very rare transmission around the world. But I think appropriately people should not be afraid of monkeypox right now.
The World Health Organization is holding an emergency meeting today to discuss that cluster of cases. They're going to take samples of each positive case and genetically sequence them to see if they're linked. The World Health Organization is expected to provide an update again soon.
All right, Paul, thank you for that. Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.